It sounds like, yeah, autonomy and control are the big differentiators for deciding to go with a private practice. How do those things tend to be affected when you're in a group practice?
As mental health clinicians, I think we've talked about this before. We are a service industry, and the revenue is generated by providing a service to our patients. When you decide to work for someone else, there's going to be expectations around, there might be flexibility in the hours you can work, especially with telehealth now, but there are
Mm,
going to be expectations with the number of hours of patients you need to see each day or each week.
right.
There might be expectations on what percent of the patients are hybrid and what percent are in person. There's going to be expectations on when you can take time off, other requests such as that. There won't be, you won't be the person who gets to decide if you get, in general, if you get to have to see a certain patient or not. So if you really prefer seeing a certain type of patient, especially like if you're a psychiatrist that enjoys doing psychotherapy, there are very few employers that allow psychiatrists to do psychotherapy now, because from a business perspective, people will tend to hire psychologists or master's level therapists, which are cheaper and can also provide the therapy service. So a lot of physicians or nurse practitioners are pushed into prescribing medications all day. And I know that a lot of people from medical school at least go into this field because they don't want to do that. They want to have time with their patients and
Mm.
perform therapy. So these are all the considerations regarding your autonomy when you're that you're going to have to give up or not have total control over if you're joining your